I'm supposed to be at a health ride event at 1. That's why I'm in my car. So, and also, just before I forget, and Jason can address this at the end of the call, since he'll take over a little bit before 1. There are some issues with some members attending some of the subcommittee events, which he'll help address as well towards the end, but wanted to bring up that to everyone's attention about members joining some of those meetings. So if we're having some issues with that, either we need to adjust the times or some of the members events. But if we can do a quick roll call then, Jason, and see if we have who's here to start the meeting, please.
Yes, thank you. All right, Dr. Amjad, obviously you're here. Dr. Eskew.
Here.
State Police.
We're here.
Dr. Khan.
Right here.
Thank you. Dr. Vaglienti.
Here.
Jesse Forbes.
I'm present. Thanks.
Dr. Maleo. Dr. Barry.
Here.
Sean Hammers. Rusty.
Here.
Dr. Antolini.
Present.
Thank you. Thank you. Dr. Milton. Dr. Milton. Okay. Joe Hatton.
Here.
And JJ Burnaby. Okay. 1, 2, 3, 4, 5, 6, 7. Okay, Dr. Amjad, we do have a quorum.
Okay. So then we can call the meeting to order. And then, has anyone have the meetings, prior meeting minutes reviewed from December 16th? Just need a motion to approve those minutes.
It's Jesse Forbes. I'll move to approve.
Jim Barry, I'll second.
Okay. Thank you. Any discussion from public comments?
I don't hear any discussion, Dr. Amjad. Do you want me to proceed with the office update?
Yes, please.
Thank you. Okay, real quick, updates from the Office of Medical Cannabis. Right now, we've received 7,310 patient applications. We have 5 operational growers in the state of West Virginia at this point. That continues to grow. Most likely by the end of today, we'll have 6. We have 2 operational processors, 8 operational dispensaries, and I do want to point out that we have a new website. However, if folks go to the old website address, it'll auto redirect to the new one. There's a ton of great information on there, and I'll encourage folks to visit. New information for this meeting, we do have some sales totals. We've sold about $1.5 million of medical cannabis products in the state so far. Roughly $1 million of that is flower, and roughly $500,000 is concentrates. By weight, we sold 254 pounds of flower, and on the concentrate side, we've sold a little over 13,000 items to registered patients. Any questions about that portion of the office update?
Hey, Jason, it's Jesse Forbes. Just a couple quick questions. I know early on, there was a lot of work by the office to try to sort of get the word out as to how to register and how to move forward with registration. It seems like those numbers are still pretty low in terms of registered patients. is there anything ongoing that the office is doing to do any more events like they did early on to try to spread the word out? Because it seems like, we're at 7,000 some odd patients, seems like a pretty low number.
Yep, we continue our outreach efforts to patients. As you mentioned, we were previously doing in-person events. We did take a pause with that during the Omicron surge, but we are planning more events now, specifically one in Charleston in the near future. However, industry is starting to take on more of that role, which we're happy to see. Throughout this process, we've asked them to carry some of that burden. So hopefully that will continue to expand. The office will still continue to hold those events as necessary, but I really see the industry taking over that function as we move forward.
Jason, where are the locations of the dispensaries?
You're putting me on the spot. Weston, there are multiple Morgantown dispensaries. Beckley, Huntington, St. Albans. Let's see, did I miss any? Oh, there's also one outside of Parkersburg.
So right now there's none in the Eastern Panhandle and not in the Northern Panhandle.
That's correct. We're still lacking the panhandles and the extreme southern part of the state. However, that should change very, very soon. One thing that's happened within the past couple of weeks is wholesale medical cannabis product has become available in the state. Previously, all the way back to November, only dispensaries that had an attached functioning grower had the opportunity to get product for their store, basically. But now that wholesale products are available, standalone dispensaries can purchase those products from a registered grower processor and stock and open their stores. So that will definitely help with dispensary availability in the near future.
Jason, I've just got a quick question about this meeting. Is this being live streamed on the DHHR's YouTube channel?
It is not, Rusty. As I explained in the previous meeting, we live streamed before because the public didn't have access to the Zoom. Now that they have access to the Zoom, at least in my view, that would be redundant. There was never any mechanism for live public comment via YouTube. So folks can watch the meeting immediately after the live session concludes and use written comment just as they would have before via YouTube.
Okay, thank you.
Thank you.
There's a comment. Did you see the comment about thought Morgantown only had one functional dispensary?
No, there are two right now, soon to be three.
Jason, aren't those dispensaries listed on the website? Folks wanted to go check that for real-time information.
Yeah, they are. Thanks for the reminder, Donnie. Part of our new website includes a live map of active dispensaries in the state. It can help patients find dispensaries and also, of course, list ones that are open in the state. Any other questions?
Do you know whether there's any people that are expressing interest in those two panhandles and extreme southern West Virginia to open dispensaries?
They definitely are. They're under construction as we speak. Okay. They're just not quite ready to open.
Okay.
But that should change very, very soon. I don't have an exact date, but it will be soon. Any other questions at this point? All right, moving on. Legislative update. So there were a myriad of cannabis-related bills during this past session that recently concluded. Everything from minor technical changes such as HB 4743 that I'll go over in a second to recreational cannabis. However, the only bill that completed the legislative process was HB 4743, and that bill reduced the time that the medical cannabis industry has to store video images from 2 years to 180 days. Now, this isn't law yet. It still has to go through the executive branch, but this bill did complete legislative action. Moving on to the directly the legislative actions directly related to the board. Sorry, excuse me. So the board sent 2 recommendations to the legislature for consideration this past session. The first recommendation was to expand the serious medical condition list. That recommendation was introduced as a bill. However, it was not taken up by committee, so it did not make it out of the legislature. Second recommendation to add medical cannabis to the CSAP system was not introduced as a bill. So again, neither recommendation made it out of the legislature. Any questions regarding the legislative process this year?
How do we, those 2 recommendations were board recommendations, our board recommendations.
That's correct.
How do we, does the governor's office take that and turn those into to bills? How do we get those sponsored?
So DHHR communicates your recommendations to leadership in both the House and the Senate, and also the governor's office. We're available to speak to the recommendations in a factual manner. However, DHHR typically does not advocate for legislation, either pro or con. Again, we only provide factual information. So it would be up to a member of the legislature to put this information into a bill and try to move it forward throughout the legislative process.
Would it be within the purview of any of us who are on the board to actually assist in that process?
I believe it would be well within your purview to advocate for your own recommendations, yes.
Okay, but those are board recommendations, so okay.
Let me add to that, sir. I mean, and this is new to me as well, but usually if it's a recommendation from a board, they would need a delegate or a senator to also sort of sponsor it, and then a board member would advocate for it as well. But you would really need a delegate or a senator to also sort of back it up, and then a board member, go there. But then, as Jason said, we just speak to it for factual information. But that's also why those things either get pushed through or not pushed through so much.
What I was asking is whether or not we could, in our role, go to a delegate or a senator and ask that they take up a recommendation. Okay.
Yeah.
I spent the whole legislative session advocating to expand the list of conditions, and the political will and within House leadership is just not there.
I can just add a little bit more to the patient condition recommendation. That was attempted to be tacked onto another bill via, shoot, I'm at a loss.
Amendment.
Amendment, yes, thank you. The amendment, however, failed in committee also. So again, it couldn't move forward. Any other questions about the legislative update?
What about the lab one? Did we talk about that one, Jason?
Yeah, Dr. Amjad, that bill actually did not make it out of the full Senate. It made it to the very last step at consideration by the full Senate, but it did not pass. Any other questions? All right, moving on. So we'll run through work group updates real quick. Mr. Forbes, you're up first.
Sure, thanks. So we met on March 1st, had a good meeting. At that time, we really addressed 3 issues, or at least discussed 3 issues. One is the relation of reciprocity, and how as a board we want to handle any recommendations with respect to reciprocity. We also briefly discussed the parameters for impairment. There's no specific standards yet in West Virginia as to how law enforcement agencies are going to address impairment under medical cannabis. Obviously, there's things they've been doing in terms of enhanced field sobriety tests, but there's no levels of nanograms or anything like that. And so that was one thing that was discussed. And then finally, how hospitals and health facilities are going to handle the folks that are taking medical cannabis, and how they're going to handle that when they're in one of those facilities. And so those were three things that were generally discussed. What we sort of settled on is to have a more full discussion on the impairment and the driving issues, and invite some law enforcement folks. And so I know the state police representation's on here, and we'll probably be talking to you about whether we could get someone from the state police or someone else that might make sense to come speak at the next board meeting. But those are the three things that we're currently looking at. We didn't from that meeting make any specific recommendations to the overall group.
Jesse, just as a little bit of follow up to that, during our interactions with the state police at the academy recently, we did speak to them about attending your work group, and they did agree to do that.
Wonderful. Thanks. And I don't know, I mean, Rusty and Joe are on there. If there's anything else they want to chime into at this time, feel free, but I think that's generally addresses what we talked about on the first.
I think you pretty much covered it.
I think you hit it.
All right, moving on to the next work group.
The one thing that I might ask is, we only have, I think, 3 of us who are on the board who are actually on that committee. And so we probably need some other volunteers to participate, because it becomes basically Jesse's orchestrating me and Rusty, and it would be better, I think, to have some more members to that policy group also.
And we had more initially, and I know, I think there was some changeover. So certainly if there's anyone that would be willing to join or has an interest in the public and policy end of it, we'd be happy to have you.
Yeah, Jesse, if you want to officially ask for volunteers, right now, we've done that before.
Yeah, if there's anyone that has an interest in that thinks they could help, we'd love to have volunteers. And if I don't want to put anybody on the spot, if they want to think about that, and maybe they could contact you, Jason, after the meeting.
Yep, definitely. If you want to serve on the policy work group, send us an email at the office, and we will facilitate that membership. All right, Dr. Berry, this takes us to health and medical.
Yeah, thank you. Unfortunately, we were supposed to meet this past Tuesday on March 15th, but just Dr. Askew and I were the only ones in attendance from the work group. And so there was no quorum to go forward. So we did not have a meeting. And let me echo what Dr. Amjad had mentioned at the outset of this meeting, is to encourage as many of the board members to please participate in this work group, and let us all work together to try to find out a good day and time that works for everybody. I know, especially for the physicians, how hard it is to get scheduling, but this is such an important public health issue. As we are entering this field, it's incumbent upon us to really do what we can to provide as much input and consideration of the issues that is definitely worth the effort. So let me encourage and challenge those to attend these in the future so that this can be productive.
Yeah, and a little bit more to that, the office is willing to facilitate that process in any way necessary. If we need to move to a different day, move to a weekend, just whatever works for the group members, we will make that happen. Is there any discussion from the membership of the work group, as far as what might work for them to make those meetings happen in the future?
Jason, and Dr. Berry, let me add to that. These work groups, and all of us are probably members of lots of groups and meetings, that if it's something that you find yourself maybe for whatever reason can't participate in, or you feel obliged to participate in, or for whatever reason want to be let go of the duties, we need to know as well, because as mentioned, some of this work does need to get done. So if you would like to relinquish your duties or pass it along to someone else, we'd like to know. If the dates need to be moved to whatever reason, we'd also like to know, but we need to move forward with these. So just please let us know, because some of this work has to get done. So I can relate to that for, meetings and obligations. So if that's the case, we also need to know. We don't want to have to come to the point where we have to ask people to come off committees and things. But if that's the case, we'll work with people's schedules. But if you're finding it hard to do it, then we also just need to move forward and get people on board, or change the timing or whatever we need to do. But that's all I'd like to add for that.
Dr. Berry, perhaps we can continue that scheduling discussion via email.
Sounds good.
Any further information related to health and medical? All right, thank you. Okay, so now we're to the main focus of this meeting. Previously, we agreed to have 4 speakers, 2 from Joe, 2 from Rusty, to speak to the home grow issue. The board did agree to allow 10 minutes for each speaker, so we'll facilitate that process. Rusty, do you want to start by restating your proposal, maybe to kick things off?
Sure. My proposal was just initially, when I made the motion, it was just a very simple proposal. I was looking at the situation on the ground here with the limited number of dispensaries open and the limited access that patients have. And, you take that into account, as well as the economic situation here in West Virginia. You could easily make the case that we're one of the most economically depressed states in the country. And, I worry that patients, although dispensaries are open and we've got this program now being implemented, still aren't going to be able to access their medicine. And for instance, the first dispensary opening, I went to Morgantown and was just talking with folks in line, and I met 2 different patients who were standing in line in tears because they were so happy that now they have legal access to this medicine, but they couldn't afford it. So they were just there to watch, but they had no resources to go in and actually buy any cannabis. And home grow, I think, is a crucial part of this. It's a crucial part of facilitating the best patient access. So, that's why I initially made the motion for the board to look at this. And, my position on the issue has not changed whatsoever. I think that this is something that should have been included in the original Medical Cannabis Act. And, I still feel that way. So I just appreciate the board's willingness to look at the issue. I appreciate all the speakers coming in to speak to the issue. And I look forward to the presentations.
Do any other board members wish to speak before we move on to the guest speakers? Okay. First up, I have Joe Dokes. Mr. Dokes, welcome. I understand you have your own slides. I'm going to stop my screen share so you can start yours.
Good morning, Jason. Can everyone hear me all right?
Yes, sir.
Yes. Thank you so much. Please bear with me as I present in PDF format this morning. Good morning. My name is Joe. I'm a retired Los Angeles County Sheriff Sergeant. I came to Los Angeles early in my career from the East Coast, where I previously worked as a Maryland State Police officer. I remember with great fondness riding through the back roads of West Virginia. West Virginia's deep history in moonshining and organized crime ties directly to our prohibition. The march forward with cannabis in your state will take a very similar path. Even if national legalization was to occur tomorrow, it would take many years to find some balance in our country. Organized crime is too deeply entrenched in cannabis, encompassing the majority of the market. I work solely on cannabis issues here in Shasta and Siskiyou counties, here in California, and I'm sharing what is occurring locally here for you to understand just how your state's consideration of greater cannabis dispensaries or home grows will simply exacerbate drug addiction of your citizens. I have submitted my slides to your advisory board to review more in depth, as well as peer-reviewed follow-on information. This week, marijuanabiz.com, the publication for the cannabis industry, says labs cannot test for everything in cannabis. We wholeheartedly agree. Illegal cannabis dwarfs legal cannabis, and there is no way it can all be tested properly. There is no seed to sale effective controls as promised and codified under our California state law, however well intended, today, with the industry controlled by the black market. I ask you to consider what will happen to your community and youth with the statistics representative of Shasta County. Your state, deeply afflicted with illegal drug use and legal drug abuse, will not receive some relief if you approve more cannabis use. It will not help your population of injured veterans already at risk for mental health issues and drug dependence. It will simply exacerbate them. Any further dispensaries you allow will support the black market because in recent years, they have become one and the same. Our investigations reveal we send our 90% of our cannabis to other states at vastly greater profits that can be realized locally. Illegal cultivation is charged as a misdemeanor in California without regard of plants. 1 to 10,000 doesn't make any difference. I'll demonstrate how quickly cannabis can change an area or community. I will highlight an area called Shasta Vista in Siskiyou County. In 2018, we had 200 illegal grows. I ask you to consider the rural richness of your state as you see what happens and how a community is taken over. Do not think that your harsh winter environment will stop illegal growers. Here they heat their hoop houses with wood illegally harvested from our national forest. Wood sells for $1,000 a cord and water sells for $1 a gallon. You will see many of our illegal operations are the size of football fields. Your total sales this year, as you just stated, Jason, do not equal one commercial size grow here in California. Before state legalization in 2016, we did not have any large-scale cannabis grows. The community would not have tolerated it. I use the word cartel, please just intersperse it with organized crime, for they are one and the same thing. We are supporting transnational crime. Rural communities across America are now being targeted by organized crime cannabis lords, i.e. cartels, because of the lack of law enforcement and inability to stop cannabis growing. As I said, in 2018, we had 200 large-scale illegal grows. Please look at the white dots on the landscape as I proceed forward in time. Every single one is an illegal grow. There are no houses or legally permitted structures of any type. The growers live in what we term shotgun shacks made from plywood and 2x4s and defecate in 5-gallon buckets. We only have 5 deputy sheriffs on duty at any one time in a huge county to address the impossible task of control. I ask you to think about your jurisdictions in West Virginia. Your law enforcement will suffer the same fate and your communities will quickly become overcome. Moving forward to 2020, we had 6,000 illegal grows and 6,000 non-native growers who registered as voters. They will vote. Shortly, Siskiyou County will be the first county in America to fall to complete cartel control, electing and filling all positions in county government if there isn't some massive intervention. The growers are well organized, well funded, and motivated to take control of local government. They have no desire to integrate into our county. They are just here for the money. When prosecuted successfully, they simply move from one location to another. They use title quitclaim and our laws against us to escape prosecution. The growers have a very real opportunity to take over, regardless of the efforts of law enforcement. Once cannabis is further legalized in West Virginia in any form, the federal help will not be forthcoming and your state resources will be muted. Moving forward to 21-22, we are experiencing now 10,000 illegal grows, with some smaller town populations being vastly outnumbered by illegal growers. These cartels have no septic system. These cartels have no electricity. These cartels have no permits, not one single one. These cartels have no water, that amount illegally pumped from the aquifer or drilled wells. Effluent and chemicals from these cannabis operations are all poured onto the ground in Superfund toxic soup, estimated to be 139,000 gallons last year. This ends up in our water and food supply. There is no wildlife left anywhere near the grows. It has all been poisoned with carbofuran or shot out of existence. Not one deer, jackrabbit, rattlesnake, field mouse, or indigenous animal is left. Wild packs of dogs roam freely, protecting the grows and scaring away the errant, unknowing, out-of-county visitor that makes it past the sentries posted at every road in the grows. Even our drones get shot at. The water stolen by these illegal cannabis grows approaches 20 million gallons of water per day. Our ranches and farms have already experienced all groundwater lost and are in severe drought. It is unsustainable. More recently, we have even found spray glue in our grows being used on cannabis to hold more pollen on the plant and hence, per the growers, increase its potency. This will be what your citizens will ingest. The actual crime, dispensaries, and further march to recreational use will exacerbate is unimaginable. So suffice to say, without massive intervention, crime will continue to overtake our counties. Many residents have already moved out under threat of death. Just like plata o plomo concept of cocaine, the organized crime grip on the county has left citizens living in fear and moving away. The real cost to a community negates any tax funds ever brought in. Funds that were promised for law enforcement or prevention miraculously never appeared and vaporized into a morass of bureaucracy. Will West Virginia be any different? Highly doubtful. Please accept our invitation to come and see the inconvenient truth of everything I have spoken about. Send a blue ribbon investigatory committee here. You would leave shocked. Cannabis proponents will say there are off-ramps and controls that will address everything I have spoken about today. I would proffer they are sadly mistaken. If California, the wealthiest and most regulated state in the country, cannot readily fix this, West Virginia would quickly be doomed to failure. There is no way you will ever know with certainty you will receive uncontaminated cannabis products. If California cannot guarantee purity with our batch testing bureaucracy, West Virginia won't do any better. Black market cannabis will by default be your cannabis. All of us today will long be gone before the chaos is remedied in any meaningful fashion. Is there an answer? Perhaps. Perhaps one day with the right controls in place for dosing, packaging, cannabis addiction, roadside DUI testing, cannabis mental health exacerbation, and the treatment for the host of medical problems coming forth from the current addicted population. Perhaps. One day, perhaps we might see some rigorous control of manufacturing and distribution of this drug. Until these controls are in place and real world means tested, adding cannabis to your population will simply find it spiraling out of control immediately, just like here. I appreciate you hearing our factual story. We are working on a national documentary about what is occurring here because America needs to know this non-native plant is destroying rural America. I would be happy to entertain any questions from your board in my time remaining. Thank you, board.
Thanks, Joe. Folks, I just want to state real quick, there is a designated time for public comment during this meeting. Please don't use the chat feature to accomplish that. Again, you will have time to comment. Are there any questions from Joe from board members?
This is Jesse Forbes. I've got a couple questions. Mr. Dokes, can you hear me?
Yes, sir. Go ahead, Jesse. I hear you fine, sir.
So it's my understanding California legalized home grow in around 2016. When did you start seeing these issues in your county out there?
Immediately after 2016. We have a 6-plant minimum. I can tell you that from my investigations, and I'm involved every day with law enforcement here, we rarely see a 6-plant grow anywhere in the county. It will be in a residential area, it'll be a 2-car garage filled with 100 plants. In the more rural communities, they just simply grow outside. There's really non-compliance with the 6-plant grow here in California, in any rural area.
I guess what I'm wondering about is that the way the presentation looks, it kind of looks like these are large industrial or agricultural grows to then. Are you saying they're selling that to dispensaries and it's going out, or is this being sold somewhere else in the black market?
Yes, so 90% of our marijuana leaves the state of California. The additional 10% is for local California use. And yes, it is being sold directly to our dispensaries. The dispensaries here in California are very honest about what has happened. They said they cannot compete with the black market and they have to take illegal marijuana in the back door. They just simply can't afford the taxes. And there is also a move ahead in our county, I strike that, in our state, to negate all taxes to cannabis dispensaries. So all the taxes that we were promised under Prop 64, there is a very strong movement statewide that will stop that. And then we'll also force cannabis on every single county in the state of California, even if they want it or not. If you want to participate in any state monies, you will be forced by the state to take a dispensary. We're working to defeat that right now, but that is in legislative committee.
Is it your position or your group's position? The way I take it, it seems to be your position that you don't think there should be cannabis distribution under a medical program at all.
Not at all, Jesse. No. As a matter of fact, we would be happy to see a medical marijuana program as designated under Prop 215 and Prop 64. We have no problem with that. We have no problem with people using marijuana with the recommendations. However, because of what has happened in California, we can't survive in these rural counties. They will not survive with what has gone on, and the state has basically been neutered in actually doing anything. We have a juxtaposition of our governor with what counties want to do, and we have these small rural counties that are targeted for growing, and the amount of money is so massive that when we have DAA forensic accountants come in and look at it, the only way they can measure it is the way that they see money move across the United States. It's that much money. One of our grows, when Jason said, "Oh, we sold $1 million+ of marijuana," I was laughing to myself. One of those football field size grows that you saw here is $1 million grow here in California, and we have thousands of them. And well, I just really showed you just one county. I didn't show you the rest of California, which all of our counties have this issue. Rural counties have this issue.
Sure. What kind of population is in those counties?
Okay, so let's see. Siskiyou is 47,000. Shasta is 180. About 25% of the people vote in any given election up there. So you can figure out if only a quarter of the people vote and the growers get together with 6,000 registered voters, they can absolutely overturn the county. And that is the position of the Board of Supervisors there, that it will happen in the next 12 to 36 months.
Okay. So you're not suggesting that medical cannabis programs need to be shut down. You're just concerned that these types of agricultural grows and things that they're beyond a 6 plant in somebody's house are dangerous and obviously they're affecting your community, and you're worried they could affect ours.
Sure. And I don't think that we're going to be able to stop, I don't think we're going to be able to legislate morality in the world. And if people want to use drugs, even if they have negative consequences to them, if we can put enough guardrails in place and enough off-ramps to protect our communities, but California has demonstrated that it can't. You looked at my stats on DUIs in our small county. We arrest 100 per month, and of those 100, 50% are now self-professing that they state that they use cannabis as a part of their DUI. We don't have a roadside test. There's not one available. They're being worked on. My brethren from the state police will comment that all of this is being worked on. But these guardrails aren't in place right now. And many of the fatal accidents we have here in California now are cannabis involved, including fatal accidents involving police officers being killed by drivers under the influence of cannabis. We have to put those guardrails in place before we say, hey, we're just going to let cannabis go in our communities. West Virginia will experience what California has experienced. And we know this as we've watched Oklahoma and New Mexico, and we've watched cannabis march eastward. And just because you're a small rural county, it will affect you just like it has here. The profit is too great, and the black market will take over without. We don't have enough law enforcement in the country to stop this black market cannabis.
Jesse,
just to make sure I understand, I mean, the folks you're talking about are flouting your law, right? I mean, these are not people that have 6 plants in their home lawfully, right? These are major grows to then sell this product illegally. The same as what we've had for decades and decades coming out of Mexico that gets sold in West Virginia illegally all the time, and probably California product.
Ladies and gentlemen, we are Mexico now. We are. They don't have to grow in Mexico. They're here in California, and they're here in Washington, and they're here in Oregon, and all that West Coast marijuana is all flowing east. But as more and more states take on cannabis and decide that they want to enable it in their communities, you will experience some of these similar problems. And you only need to go back and look at moonshining. And when I identified all the gangs and the cartels that were involved, we have local growers, people that are very poor. These are very poor counties, like many of the places in West Virginia. And people will look, how can I make some easy money? And there is easy money to be made in marijuana. And whenever you have easy money to be made, you will have corruption.
Folks, I don't want to cut off any discussion for members, but one of the speakers does have a time conflict, and she's asking if she can speak. Are the members good with letting her go?
Absolutely.
Okay. Dr. Sisley, are you still here?
Yes, I am, sir. Thank you.
Okay. Your time starts now.
Okay. And I apologize. I'm gonna. I basically am in the middle of a meeting with our FDA study drug manufacturer. So I've broken away from this board meeting so that I can talk with you, because I think this is such an important issue. My name is Sue Sisley. I'm an internal medicine physician based in Arizona, where we've had a very successful, well-regulated medical marijuana program for the last 10 years. We are in a very conservative state. We have similar problems to West Virginia in terms of opioid epidemic. We have tonnage quantities of opioids coming across the border with, serious overdose fatalities occurring. And I serve as, I'm a FDA approved clinical trial researcher on cannabis. So just to make sure you're aware of my background in cannabis, I do clinical trials studying cannabis as a potential medicine for treating pain, PTSD, and opioid reduction. And our institute has published, we're a nonprofit institute. We have published numerous articles with University of Michigan about the potential for cannabis to reduce opioid dependence, describing its opioid sparing effects. And that's really important for folks to know, especially in light of the last speaker, the extremist views that were presented, where he was describing, basically conflating illegal cannabis grows to the cultivation sites for sick and debilitated patients in a regulated program. Completely different scenarios. I understand when I started this observing these programs, I functioned as a medical director for just as a volunteer medical director for these different license holders in Arizona and throughout many different states across the country. And I was very skeptical about home grow and concerned about the potential for diversion, theft, abuse, sort of overdoing the limitations that the program allowed. And in fact, my views have evolved over time, because I have seen firsthand that the sick patients in these programs do not abuse the limitations. And in fact, there are many benefits to them growing their own medicine. First and foremost, the importance of keeping their supply chain intact. The importance of, once they find that best medicine that fits their needs, it's crucial that they're able to continue that day after day. And with the supply chain problems in our program, we have 130 different license holders in Arizona, and we can barely meet the supply demands of our program. So imagine the few operators that you have in West Virginia. The chance that there will be shortages over the next few years is a real issue. And I think patients deserve the opportunity to be able to secure their own medicine and guarantee that it is readily available day after day. I think that there is benefits to patients growing their own medicine in terms of the therapeutic efficacy of, when patients are able to farm their own medicine, there is a unique connection to the medicine that cannot occur when you're taking a chemical generated by a pharmaceutical company. There's a special therapeutic benefit to that is difficult to measure, but it is well known and well described by veterans, by terminally ill patients, by cancer patients. So I really encourage you to consider that. We are attempting to present a discussion through the National Institute of Complementary and Alternative Medicine to compare people who take cannabis from a dispensary versus people who are actually growing their own material. And I'm eager to see the results of that study because I think it will show tremendous more benefit for patients who are able to cultivate their own material. But I think the issue, I just visited West Virginia. I spent 2 days with Senator Joe Manchin, and we talked extensively with him and his wife about the opioid epidemic there. And it is clear to me that cannabis is an exit drug. It is just, despite all the antiquated ideas about cannabis being a gateway drug to more serious or creating a new addiction. In fact, we've demonstrated and have peer-reviewed published data showing that cannabis is an exit ramp off the opioid epidemic, off the opioid dependency hamster wheel. And I think that it's really crucial that that patients are able to mitigate the potential shortages in the future, because there will be, despite even the best well-run programs in the country, you can't prevent shortages from occurring. You cannot prevent that. Hi guys, thank you. You can't prevent that from happening because there's crop failures. There's explosions in the number of patients that are approved and the inability of them to respond to that. So I would, I am confident that Jason, he's run this program extremely well from the beginning. And I feel like if I could invite Jason to Arizona to visit our regulated market and see the way home grow has been executed there, I am certain that he would feel confident he could easily replicate a similar program that didn't create these opportunities for abuse, for diversion. And the fact is, in 10 years of running this program, we have never heard we have almost 350,000 medical patients at one time last year, and less than 10% of those patients were certified for home grow. And we don't hear about issues of them abusing. You don't hear about them in the newspaper. You don't read about the drama of what was talked about by the previous speaker, of them diverting to children and things like that. These are sick people who need the medicine. They need something affordable. They can't pay $500 for an ounce of flour. They have to be able to, they're used to paying a small copay on their health insurance, a small copay to be able to get their medicine each month. But with cannabis, they're forced to pay $500 to $1,000 a month just for the very simple medicine that they could probably grow at home for less than $100 a month and be able to keep their supply chain going. So I'm afraid I've exceeded my time, but I just wanted to make sure that that I could take questions.
Now you still have 3 minutes if you have more to say.
I do. Okay. Yeah. Let me just say a couple other things. That I think that that the problem. Let me just look at my notes to see. I apologize because I was not able to prepare for. I only heard about this yesterday. Otherwise, I would have been happy to organize slides and present data from our published clinical trials. But in the midst of that, I think that's the bottom line is the risk of cannabis versus untreated symptoms like untreated pain, people relying only on opioids, untreated PTSD leading to suicide. It's so clear that patients need a consistent, reliable supply chain that is affordable. And that is the key. We can't risk impoverishing these sick patients in West Virginia by forcing them to only purchase from the regulated market. I mean, the regulated home grows are a part of the regulated market. And I want to give Jason the confidence to know that he can. There are great models around the country of states who have done this correctly. Please don't use California as the gold standard for how home grow should work. That is a terrible model. None of us try to emulate that. All of us are disgusted with how California has played out. And there are good models in conservative states that have managed to do this correctly. And I invite Jason to come out here and work with Tom Salo, our medical director, and he can show the how this has worked properly in our state. So that's it.
Thanks, Dr. Sisley. Any questions for Dr. Sisley? Or I know we had to kind of cut Joe off there a little bit. Any questions for either speaker so far?
Yeah, I had a question for Mr. Dokes of the illegal grows that you're talking about. How many of those people that are arrested are legal medical cannabis card holders? Because I do think it's important for the folks watching this to understand that we don't have recreational cannabis in West Virginia. If patients are growing here, if they are afforded the ability to grow, these are folks who have registered with the DHHR. We know who they are. It's a completely different situation. So I'm just curious, of those big monster illegal grows, how many of those folks are medical cannabis card holders?
I would say there's zero. I would say that, yeah, there's zero. It's all organized crime. It has nothing to do with medical marijuana at all. Legitimate medical marijuana users in California, we would never look at someone growing 6 plants. As a matter of fact, when we do enforcement operations, we don't even look at 100 plants. We only look at thousands of plants. So nobody involved in medical marijuana is involved that I know directly in those operations.
Thank you.
I have a question also.
If I may, Joe. Thank you. Follow up on Jesse's sort of questions earlier too. So, looking back, Mr. Dokes, in what California did in trying to set a limit with 6 plant minimum, what was the intent as far as that was concerned to protect the public, and where did it fail when you tried to actually implement it, and what lessons can we learn from that if this is a consideration?
Well, originally under Prop 215, going back to 2012, it was 12 plants, and the state tried to regulate it by showing that if you had a certain parcel, a certain size, you could have 12 plants, and that was fought through the legislature, and we came out with a 6 plant maximum. And if you look at in California, a grower that can grow 6 plants, an excellent grower, that's 30 pounds roughly of marijuana with your 6 plants. 6 times 5. If they're an excellent grower, they can get it up to about 5 pounds. Many of the plants that you see in those large commercial operations are the size of Christmas trees. So a very efficient grower can have 30 pounds of marijuana. If you extrapolate out the amount of 1 gram joints, you would have a user that would be able to use that amount of marijuana. They'd have to smoke 24/7 every day to use that amount of marijuana. So we're providing our medical marijuana users the ability to have what I would consider to be a gross amount of marijuana that they use. Where did it go wrong? There was a very targeted group of attorneys in California that represented growers and represent illegal growers, and they actually looked at the rural counties at where they could make the most money. And as soon as the black market started, it blossomed. You saw in 3 years from the pictures from 2018 basically to 2021, now 22, it's impossible for the state to even get control of it. And there's a juxtaposition in the state. Governor Newsom wants to expand marijuana. The counties want to continue to control it. We're all stuck in the middle. So it's a mess. So I would say for your state, if you had a medical marijuana program that was rock solid and you didn't have any tolerance of illegal growing beyond that, in other words, your law enforcement and your district attorneys and your state code of laws allowed for strict enforcement beyond that. Where we made a mistake is as soon as we turned marijuana cultivation into a misdemeanor, and that doesn't matter, 1 to 10,000 or however many plants. As soon as we did that, that's what really ruined California. So keep cultivation, illegal cultivation, a felony in your state and prosecute it aggressively. Don't go after the medical marijuana patients. They're growing 6 plants or whatever your state's you think is reasonable for your state. That's what I would do. I hope that answered your question.
Thank you.
Joe Deegan, did you have a question before we go on to the next speaker? However, I do want to remind everybody we still have 2 more speakers plus public comment.
I was going to ask a similar question to Jim, so I can follow up later if I feel like I need to resolve any of that.
Any other questions from the members? All right, so I'm going to skip back to the agenda. We have Karen O'Keefe next up.
Hello, good afternoon. It's good to be with you. I am Karen O'Keefe. I direct the state legislative department at the Marijuana Policy Project. I'm an attorney and I've been with MPP since 2003. We are a nationwide nonprofit that works to change marijuana laws, including to pass medical cannabis laws. And we also spend a lot of time comparing various laws and looking at the data and how things are going there. We strongly support home cultivation. This would be, in most states, someone growing around 6 plants in a secure location that's not visible from the street or to the public, or designating a loved one to do so for the patient who may be too ill to cultivate on their own. One of the main reasons that we support home cultivation is cannabis simply is not affordable for a lot of patients, and it's essential to their well-being. Patients have been able to successfully manage seizures, spasms, chemotherapy, and so many other ailments with cannabis, but if you can't afford it, having a law is worthless for a patient. In a 2018 survey, another nonprofit, Americans for Safe Access, found that on average, every month, medical cannabis costs between $50 and $1,500 a month. And a lot of people cannot afford that at all. And as a result, they either have to suffer without cannabis and use opioids or other more harmful drugs, or some go to the streets where it's often cheaper. We were very involved in the Minnesota medical cannabis law, and the patient that was in TV ads that we put out, Patrick McClellan, had a muscular dystrophy with very, very severe spasms. And after the law passed, because cannabis was so expensive, he just went to the street, which is obviously far less safe than cultivating your own supply. That's one of the states that does not allow home cultivation. So by allowing home cultivation, patients will be able to securely grow a modest amount of cannabis. They would, of course, have to register. Their ID card would say that they're a patient. When I first started working on this issue back in 2003, the federal government was very hostile. So basically no states had medical cannabis dispensaries that were licensed and regulated at that time. And every state had home cultivation. And we looked in 2013 to see how many people had had their ID cards revoked for breaking the law. I haven't done the query recently, but at that time, in every state that we asked, between 0 and 3 people had had their ID cards revoked for in some way breaking the law, or not notifying about a change of address, diversion. So it's a very, very small number of people that had their ID cards revoked for any reason, meaning it simply did not cause large-scale problems. Out of the 37 states that have medical cannabis laws, 20 of them have home cultivation, and most of them are small scale. You can, as a caregiver, grow for a handful of patients or one, depending on the state. 14 of the 18 legalization states also have home cultivation. Simply has not been a problem. Some of the states had made adjustments to their law. So for example, in Colorado, at one time a caregiver could grow for unlimited patients and could grow up to 100 plants. And that did create some possibility of people, selling it out of the back door, so to speak. So they adjusted the household cap, and it's working much better now. So by basically having a relatively small limit, but enough for a person to grow on their own, you can address any issues with diversion while letting sick people have a steady access to their medicine when they can't afford it, or when their strain's simply not available. We've heard of a lot of people that have a specific strain, a specific amount of CBD, CBN, THC, and all the other cannabinoids that works best for them. And then if their strain stops being available, they don't get the relief that they need. So if a person can grow their own cannabis, they can actually have exactly what works best for them too. I live in California myself, and I want to make sure that it's completely clear that the presentation about California was not about the medical cannabis program. The medical cannabis laws was mentioned, passed back in 1996. Home cultivation of medical cannabis was allowed from the outset. The other speaker mentioned that in 2016, he thought problems began. That was well after medical cannabis cultivation began. That was well after medical cannabis passed. That was when adult use legalization passed, which with it included reducing the penalties for up to 10,000 plants, any amount of plants, to a misdemeanor. So these were not problems with a small regulated home cultivation program. In terms of how much a plant produces, at the University of Mississippi, the federal government grows cannabis outside with botanists that know what they're doing. And I believe, I'm gonna have to double check this, and I can follow up and send it. I believe it was around 3 ounces a year was produced. So there might be somebody, the person that wins the state fair for the best plant that they grow is an outlier. Most people who are patients that are just trying to help their medical needs will not be able to produce Christmas tree sized cannabis plants. They'll be very small in most cases, a few ounces a year. So 6 plants is about what most of the other states allow, so that people have a chance to actually produce a steady supply. One thing that a state could do instead, if you want to guard against the person with a very green thumb, is you can potentially limit the canopy size, so how big the flowers are, which is another way to limit the total amount of cannabis produced. So that could be done instead. As Dr. Sisley mentioned, medical cannabis for so many people is an alternative to opioids. We've seen studies in states with medical cannabis programs that people that use medical cannabis that had previously used opioids were able to reduce or eliminate their use 60 to 70% of the time. So it can save lives both by stopping a person from being suicidal from PTSD or from intractable pain, and also by stopping a person from using an amount of opioids or any opioids that could kill them. Medical cannabis has never caused a fatal overdose, whereas opioids in West Virginia killed more than 1,200 people from fatal overdoses in 2020 alone. So this is something that we think is very important. The reality is, if you don't allow home cultivation, some people will go to the streets, some people will suffer and use opioids, and that many states have programs that are not causing problems by having a limited number of plants you can grow. If a person diverts, they would have their license revoked. What was being discussed, the previous speaker mentioned, none of these cases, 0, were people that were medical cannabis patients. So I wouldn't let that distract from protecting people who are sick from being able to cultivate a handful of plants for their medical needs. And I'd be happy to answer any questions. That's it.
Any questions for the members for Ms. O'Keefe?
I don't have a question for Ms. O'Keefe, but I would like to highlight something that she said as far as folks getting, the patient getting used to a strain or finding a strain that they like, and then, that's no longer available. That is already happening here in West Virginia. A patient reached out to me who was traveling. At the time, the only 2 dispensaries open were Morgantown and Weston. And this gentleman was traveling 3 hours to Morgantown to the dispensary, and he found a strain, he said, that worked better for his condition than anything he'd ever had. He was elated, drove back a couple of weeks later to that same dispensary, and that product is no longer available. And when he reached out to me, he was in tears. He thought that he had found something that really worked for him. And when he inquired the dispensary personnel about when they were going to get this strain back in, their response was, "We don't know." So, I just want to highlight that part of your remarks and let people know that that is absolutely happening here. And, he again, when I spoke to this gentleman, he was in tears, trying to figure out how he could move out of West Virginia because of this problem. So, I just would like to make the board aware of that issue and kind of share his story. But thank you for your remarks.
Yeah, Ms. O'Keefe, could you please provide us a bibliography of these studies you quoted so we could review them as we go forward in developing these policies? I assume they're peer reviewed, and I assume that many of them are randomized controlled trials, and I'd appreciate that greatly.
I'd be happy to provide them. The ones I mentioned were people enrolled in medical cannabis patients in programs, and those can't be randomized because they're people in programs and you can only use federal cannabis for it, but they are surveys, and I'd be happy to provide them, as well as the actual number from that cannabis yield study of how much cannabis is produced per year on average.
Any other questions for Ms. O'Keefe? All right, for our next speaker, we have Dr. Ken Finn.
Hello, can you hear me?
Yes, sir.
Can I have share screen capacity, please?
Yes. Okay, you should be able to share.
All right, can you see those all right?
Yes.
All right, so thank you guys for taking this issue on. Hold on, I have to stop my share for 1 second because I need to be able to read a couple things. You have my bio. I'm a practicing pain medicine physician in Colorado Springs since 1994. I'm board certified in physical medicine and rehab, pain medicine, and through the Board of Anesthesia Pain Management. I'm the current president-elect to the American Board of Pain Medicine, and I've served on their exam council for over 20 years. I served on the Colorado Governor's Task Force on Amendment 64, which legalized marijuana for recreational use in the Consumer Safety and Social Issues Work Group. And I served 4 years on our state's Medical Marijuana Scientific Advisory Council. I do a lot of public speaking and have testified to the Canadian Senate on their marijuana bill, and I speak internationally. I'm the editor of the first U.S. medical textbook, Cannabis and Medicine, an Evidence-Based Approach, with 70 authors in 4 countries. I'm currently the co-vice president of the International Academy in the Science and Impacts of Cannabis. Just a couple of follow-up comments before I get going regarding Dr. Sisley and her notation on opioids and in our opioid crisis. Interestingly, we've had another record of 100,000 people dying from opioid overdoses last year, with more states legalizing for medical and recreational purposes, so it doesn't make any sense. I'm more happy to provide you the International Academy of the Science of the International Academy on the Science of Pain, where they scoured the medical literature and at the end of the day have shown that cannabis is not a proven analgesic, or is it an opioid sparing substance. She also mentioned that we should be able to farm our own medication. So I would assume it would be okay for me to grow my Pacific yew tree and treat my wife's breast cancer with Taxol that comes from the Pacific yew tree. I would go on record, invite Jason and anybody at the board to spend time in our local emergency rooms to see what's actually happening in our communities since we've expanded our marijuana programs. And I would invite Ms. O'Keefe to see the grows and plants that Joe Dokes is referring to. Just one quick story regarding emergency medicine. There was a 13-year-old girl brought to a local emergency room with suicidal ideation that tests positive for only marijuana. Her parents got the message that it's harmless, it's safe, it treats a bunch of conditions. So they allowed their 13-year-old girl to use cannabis, and she started using a year or 2 prior. By the time she was seen suicidal in the ER, she was actively addicted. She'd been using more than what her parents would allow, so she was trading sex for weed in middle school. We do not have enough adolescent psychiatric or addiction treatment beds in the state, which is a whole other discussion. She literally waited days in the ER for placement, which couldn't be found. This is just one story, and my colleagues in the ER say that she would like to say these are isolated incidents, but cases like this are seen every single day in the ER, and that's a new phenomenon since we legalized. All right, I'm going to share my screen now. There it is. So disclosures, I do get honorary for presenting scientific evidence on cannabis, and I do get royalties for my book. It's not something I'm going to retire on. The Colorado Rules Amendment 20, we voted for in 2000. We implemented in 2001. That was our medical marijuana program. We can possess up to 2 ounces. Up to 6 plants are allowed per resident over the age of 21. 3 are flowering at one time, and I don't know anybody who is actually able to monitor that. We have caregivers, the parent, advising caregivers, transport caregivers, cultivators. We have 5 patients and up to 36 plants. So what is 2 ounces? 2 ounces generally, 28 grams per ounce. So 56 grams per 2 ounces, so 112 joints. So there's some dosing information. The dronabinol, which is a synthetic THC, which has been around since the mid 80s that nobody asked me for. The starting dose is 2.5 milligrams, and in Colorado, a dose is considered 10 milligrams. We also have an ounce. Here's an ounce of THC oil, which is the equivalent of about 2,800 servings of gummy bears. Here's a graphic of the opioid overdose deaths, and Ms. O'Keefe noted, and Dr. Sisley talked about, we're doing really well in terms of using cannabis as an opioid substitute. Again, we've had medical marijuana since 2001. We had de facto legalization in 2009. We implemented legal marijuana in 2014. And if anybody can show me or explain to me on this graph where Colorado is doing better in terms of their drug overdoses, please explain it to me. And just as a disclosure, I am a registered medical marijuana patient in the state of Colorado out of curiosity based on what my patients were telling me. I was able to secure my medical marijuana card in 60 seconds. I did get my renewal about 3 weeks ago, and it took 3 minutes of complete silence and was approved very easily. And any 18-year-old in the state kind of underscores how easy it is to access medical marijuana. Currently, marijuana is the most prevalent substance seen in completed teen suicide in our state, and that interestingly correlates when we legalized. In Colorado, 6 plants doesn't equal 6 plants. So I can literally, as a medical marijuana patient, go and grow my 600 plants. Nobody's testing. So here's a marijuana home grow in Denver, nice homes. Why are they wearing hazmat suits? Because my friends in law enforcement and DEA don't know what are on these plants. Do they have anticoagulant rodenticides, pesticides, fungicide, insecticide, other poisons, heavy metals, mold, yeast, who knows? And they're not regulated or tested. Here's an example of a home grow, 42 arrested in one of our state's largest marijuana takedowns, multi-agency investigation, 240 home grows, 255 warrants in 8 counties, 80,000 plants and 4,500 pounds of product were seized. These are from my friends in law enforcement. I mean, I like Christmas. My wife would never let me do these elaborate electrical grids at all. And this is what our law enforcement are running into in these home grows. Hazards for first responder. There's altered electrical systems and wiring. There are tripping and entanglement hazards in the event that this house catches fire. They have commercial grade heating elements inside the residential homes. They have do-it-yourself ventilation. My friends in the agent in charge in Denver told me that the R30 rating, which is the 30 minutes to get out of your house if it's on fire because of insulation, gets ruined. So they poke holes in the outside of the homes and the stairwells, the drywall, and your R30 rating becomes an R5 rating. And there's no registry that your house was a prior marijuana grow house. Here is a massive grow in a Colorado home after there was a fire last year. There was an illegal marijuana grow, more than 1,400 plants on the property, estimated about 1.4 million. So the number of marijuana plants in this grow was a sign. It was solely intended for the black market, but any medical marijuana patient can do this. There was the reason they got this tip was because there were the elaborate electrical panels and huge air conditioning units. Here's the one in Greeley, Colorado. Here's another home grow. Mold oozing out of the house. Drywall is not a good medium to grow crops. So this house was destroyed. Just a couple of years ago in Pueblo, there was another home grow that was seized, 97 plants, 2 separate illegal grow operations. Now we're seeing untended marijuana growing in the national forest here in Colorado. Here's another Pueblo County home, 200 marijuana plants in a home grow. The home had to be condemned due to the alterations made to the electrical system. And interestingly, this home was also a site of a grow a couple of years prior. So these, the law enforcement is going and eradicating these home grows, and then they come back like cockroaches. Here down in Southern Colorado, here's a gentleman who was had half of his residence covered in nearly 80 plants. He was high on dabs and runs over and kills his toddler. Here in Pueblo, home grows again, tied to Cuban syndicate. I mean, we have every foreign national living in plain sight of the law, doing exactly what is going to happen in West Virginia if you continue to let this happen. Here, there was a house that was sold for nearly $400,000 in 2017. It was so infested by black mold, it was deemed uninhabitable. There were 5 other homes that were ruined by large home grows on the inside. So they had 1,000 pounds of marijuana, 2,000 plants inside the 6 homes. This was tied to Chinese cartel. Here in El Paso County, where I live for the past 28 years, we had 650 home grows across the country, and bless Sheriff Elder's heart, he's been able to do a lot of work trying to eradicate the home grows that are happening in our community. So there used to be able to be 6 plants per adult, but we had a 12 plant cap. So a lot of these do not comply with the 12 plant count that comes directly from our sheriff. In California, I think Joe had mentioned, here's the Google map from Shasta Vista in 2017. And in 2021, all those white dots represent illegal cultivation. There's a guy in California who got 6 years because he was growing and admitted to starting at the 2014 Nichols fire, which burned 1,600 acres of wildland and caused $6.5 million in damage. He was fearful that the workers at the site were intended to kill him. In West Virginia, I mean, it is happening. I had a nice discussion with the West Virginia State Police yesterday.
Dr. Finn, I need you to finish up. Your time has elapsed.
I'm coming down to it. By helicopter, by foot. Just in summary, home grows are simply breeding grounds for illicit market and lost state revenue. And unfortunately, I do believe that the industry is allowing this to happen, and the patients that actually could benefit it are paying the price. Policies need to be common sense, science-based, should not be based on public opinion or personal stories or anecdotes. You should have potency limits based on the current scientific evidence. And it's important that you spell P&L, profit and loss, because I hear a lot of these states talking about how much money they're making, but never talk about the societal costs that are going to happen. Just like tobacco and alcohol, they make a ton of money for the respective industries, but we know the negative societal costs. So I think you need to follow the science, not the money. This is my book that I edited. I didn't write anything on purpose. And here's a link to our website at Isaac. Thank you guys for the time.
Okay. Can you stop your screen share, please?
Yes, sir.
Thank you. Any questions for Dr. Finn or any of the previous speakers from board members?
I would reiterate the invitation to any of your members on the board or the prior speakers to come and spend one day in our local emergency room. We have yet to have any state leader or take us up on the offer.
I don't have a question, but I would like to say, from the patient's point of view, a lot of the horror stories, and we've heard these things before about people who've been invited to come in, that, cartels are going to come in here and they're going to, this is going to the sky's going to fall essentially. And as a patient, I take offense to the notion that medical cannabis patients are automatically looked at as criminals, like they're going to get a card to grow medical cannabis, to grow their medicine, and that's going to, I guess, be the motivation to turn them into Scarface. It's just absurd. We don't have a program like California where you're going to go in and get approved in 60 seconds. We don't have a program like Colorado where you're going to go in and get approved in 60 seconds. In this state, you have to have cancer, ALS, Parkinson's disease, multiple sclerosis, epilepsy, severe chronic or intractable pain of the neuropathic origin, or severe chronic or intractable pain, terminally ill, HIV, AIDS, Huntington's disease, intractable seizures. These are serious conditions. PTSD, we send more West Virginians to armed conflict than any other state in the country. We have the highest concentration of veterans than any other state. And these folks deserve to have the right to use a natural alternative to pharmaceuticals. So again, I do take offense to the notion that just because somebody, gets a medical cannabis card, that they're automatically intent on turning themselves into a criminal enterprise. I just think that notion is absurd. And again, most of the presentations that we've heard about how scary home grow is and how awful this is for society, are you talking about recreational states? West Virginia patients have to register with the DHHR. They have to be certified. It has to be certified that they have one of these extremely serious conditions. And again, as someone who experienced chemotherapy and cancer firsthand, if I was able to grow my own cannabis to use, the last thing on my mind would be, hey, I wonder if I could sell this. That's just not a realistic outlook.
Any other questions or discussions from board members?
I just want to make a comment. I understand where Rusty, what he's saying, and I don't think that there is any direct accusation that people that have conditions that warrant being able to being able to home grow. I think it's just the caution that we don't allow something to happen without having guardrails up firm and steady, so that we don't run into conditions like in these other states, like California and Colorado. And if someone has a firm way of doing it with the proper guardrails, I mean, that's one question I would have with Joe Dokes is, does he have has he seen a situation where the guardrails are put up and secure, so that when this happens, that you don't have a black market jump into the mix? We're not talking about the people that are that in need of medical cannabis. We're talking about the people that will come in and take advantage of opening a door. And that's the caution that I am concerned about. And I just wondered whether Joe has any comment about that.
Well, again, thank you. I would restate, and for all the people that are here today, that I'm not opposed to medical marijuana, and I don't think we voted for Prop 64. I think it was like 54% of Californians have voted for Prop 64. So we're not opposed to medical marijuana here as a state. When recreational marijuana occurred, I think that the state would like to see a reset, that many people would like to see a reset on that based upon what has happened in these rural counties. Again, if someone wants to take marijuana for an end of life condition or a condition that they feel it's good, we don't have any problem. The speaker that spoke about being vilified, that doesn't go on here in California. We in law enforcement, we absolutely support medical marijuana patients. And if we could reset California, and if we could do large commercial grows in the Central Valley, and if they were all highly regulated, I don't think you'd see any of the things that are going on today. But the state can't do it. And once organized crime gets a hold of your state, it's extremely hard. And I would refer to my West Virginia State Police officer that's here today. Once organized crime is involved in your community, you can't get rid of it. It's too overwhelming. Did I answer your question, Joe?
I would like to hear a comment from the state police representative that, just what he's seeing right now, and in his mind, would this open a door like that the wheels could possibly come off? I mean, I'd like to hear a comment from law enforcement in West Virginia about this.
State police, do you feel like you can comment there?
Yeah, I'm sorry. I only caught part of the discussion there. I was on another call. I heard you talk about organized crime. You talk about medical marijuana coming in and that increasing the crime rate. I'm sorry, I didn't hear the question.
The concern is there enough of an organized crime, or is it, what is going on right now about illegal marijuana in West Virginia? How widespread is it? Is the state police or the county law enforcement, are you able to maintain any kind of controls over it in its present state? So if we threw in ability to home grow, what effect might that have on the illegal situation that we already have in place in West Virginia?
I mean, do we have a handle on illegal drugs? I mean, no. I mean, that's been going on for forever. There's no way to actually control and prevent illegal drugs coming into the state.
No, I'm talking about growing marijuana in the state.
Yeah, I mean, every year we're seizing illegal grows. I mean, every year we do marijuana eradication, and there's certain areas of the state it's just abundant. We get it every year. I mean, if it's legal to grow, I mean, there's places like that now that has hemp farms and stuff. I mean, they have their permits on file. We know where it's at, but there's also always the possibility that then people's growing illegal marijuana in with them hemp farms.
So My question, of the illegal grows in West Virginia, how many of the people do you bust a year that are have willingly signed and registered with the DHHR? You know, because that's the situation.
Yeah, mostly the ones we get, the illegal ones, they're out in the middle of nowhere. They're not when they're the grower's actual property. It might be on the neighbor's property and something of that nature. And unless we actually catch them on film going into the grow or have information they're the actually ones growing it, a lot of times we don't get any prosecution out of the grows we seize.
Jason, am I correct? I believe that the patient registry, you know, just the medical cannabis patient registry that the DHHR has to keep, doesn't law enforcement have access to that list if need be, if there was, you know, a situation that presented itself where they needed that information? Can't they access that?
Yeah, absolutely. It's part of the code that they can have access, and we've already verified several different cards with various law enforcement agencies across the state.
Thank you.
Folks, just to keep us on track here, I don't have a time limit, but I have a feeling we're going to start losing members. Before we have any more discussion, does the board wish to take any official action on this topic right now before members start dropping off? And if not, we can go back to the discussion. All right, I'm going to take that as a no. It looks like Dr. Finn wants to comment further. As long as no members object, we'll let Dr. Finn do that.
Thank you, guys. Just a couple follow-up comments. I know I may sound as a nihilist, but I'm not. I actually have made several medical marijuana recommendations for my terminally ill and suffering patients. I'm not against medical marijuana. I am concerned, however, about product integrity and contamination and lack of regulation and control, and there's not been any state so far that's been able to do it well. As far as I understand, that West Virginia does not have any limitations on isomerization or acetylation of hemp, which is mass producing CBD, and via a variety of chemical reactions can create delta 8, delta 10, THCO, which is the acetylated form of THC, which is not naturally occurring, but is mass produced from CBD. And is 3 times as strong as delta 9 THC, and was weaponized by the US military back in the 40s. There's also HHC and all these other derivatives that are being mass produced from hemp, from CBD. And currently, West Virginia doesn't have any caps, guardrails, or monitoring of these products that are easily accessible to youth as they are in other states.
I just want to make a quick comment on that, as I did by email yesterday. OMC is not the regulatory authority for hemp, so I can't speak to those issues at all. I know Ag is on here if they wish to, that's fine, but I just want to make it clear that we're not the regulatory authority for hemp or hemp-derived products.
Yep, this is Joe Hatton. Jason, thank you for identifying that. So Department of Ag has taken a stance that we will regulate non-naturally occurring cannabinoids related to hemp. The real problem in our state law, from what we understand, is a gap between the non-naturally occurring activities and some of the synthetic activities that was identified a minute ago. Those are gaps that need to be fixed if we so desire to go and regulate those in the state.
Can you home grow tobacco in West Virginia? Just a question.
Do we grow tobacco in West Virginia?
Can you grow tobacco at home in West Virginia?
Yes.
Any further discussion from board members or questions for our guest speakers? Okay. Rusty, since this is your original recommendation, what do you want to do? Do you want to continue with further discussion at a future meeting? Do you want to send it back to a work group?
You know, I hear from patients every single day, and this is the most brought up issue. I typically hear about home grow, and then I hear about reciprocity. We've looked at this issue now for over a year. It's been to the work group at least 3 times, and I believe this is the second time it's been presented to the full board. I would be prepared to make a motion so the West Virginia patients can see exactly where the board stands. I would be prepared to make a motion and vote on whether or not to recommend the legislature add a home grow provision to the Medical Cannabis Act.
Hey, Jason, before he makes that motion, can I just ask how many members are still on the call? Do we still have, I mean, and Russ, to make whatever motion you want to make, but I just want to make sure, I just wonder how many people are on now? It's 1:31, I think.
Yeah, I was going to mention that too. I have to log off and start clinic right now, so I apologize.
Yeah, Dr. Amjad had to leave a while ago. Honestly, Jesse, it's difficult for me to tell if we still have a quorum or not.
Rusty, again, totally, you want to make a motion, make the motion, but one thought might be, do we want to just put this up for a vote at the next meeting?
I mean, I would, if we don't have a quorum, then I don't think.
Well, we had a quorum at the beginning of the meeting, so I think we're okay, actually. Although I'm no expert on the procedure. Jason will tell us if we're doing it wrong.
Unfortunately, I'm no expert there either, Jesse. I can count votes if the motion's put forward.
I mean, I would defer to the to you and Mr. Deegan. It's been to our work group. We've discussed this issue the most. So, I mean, what do you guys think? How are you feeling about it?
I've got no problem with if you want to make the motion and put it up for a vote. I just wonder if we ought to do that when we have, really, hopefully the entire board present. I know that, with all the speakers, we're now past the allotted time we originally set for the meeting. Obviously, the chair had another commitment. I know some other people seem like they're dropping off. So if you want to make the motion, that's fine by me. I mean, obviously make whatever motion you want, but we may want to just say, hey, at the next meeting, let's just take this up. You're going to make a motion for it and just take it up as one of the first things to deal with. No, we can have further discussion if we want, but we don't have to invite speakers for that. And we can just put this up for a vote at that time. The legislative session just ended. So, for the public folks that are on here, any recommendation, even if this board would make a recommendation at this time, our role as an advisory board is to make recommendations to the legislature and to the executive branch, to the governor. And those things are things that get taken up in a legislative session, as we talked about at the beginning of the meeting with 2 proposals we had previously recommended. So I don't know that there's an urgency of whether the vote on this occurs at this meeting or the next meeting, given that the legislative session just ended, isn't going to start again.
Yeah, I agree with that. That sounds. I'm willing to wait until the next meeting of the full board. I do think it's important that all the board members are here when the vote happens. So yeah, I'm good with that.
Okay, we'll put that down as an action item then for the next meeting.
Thank you.
Joe, it looked like you had a comment. Joe Deegan.
No, I'm good. I was going to say the same thing. I think that I don't think we have a quorum right now. My count is, I think we have 7 of the members. We need to have 8.
Yeah, we have to have 8. Okay. Any other discussion regarding home grow before we continue on with the agenda? All right. So next up is public comment. Crystal, if you can turn the chat back on, please. I do want to address that real quick with the members that we do have. It looked like the chat was heading in a negative direction. So I asked folks not to use the chat in that fashion. They continued to do so. So I asked that it be turned off. However, this is not my meeting. I'm just the facilitator. So I want to get the board members' opinion from the members that are here. How do you want to handle the chat feature in the future? I'm concerned about giving free reign access to the chat during the meeting. Any opinions from the board members?
Well, from my thought would be that we either leave it open, or if you want to just disable the chat until the time of the public comment, and we could solely use the chat feature for public comments and then just start it at the time that we're going to do the public comments. But I don't like the idea of having the chat started and then stop for a period of time, because I do think that maybe there could be some confusion from the public, and at least from my view with that is that we ought to hear from anyone that's willing to come take part in this, that is a citizen of West Virginia or just has some interest in this otherwise, ought to be able to come in and make their comments. I mean, we used to spend a lot of time at the in-person meetings prior to the pandemic with a lot of people that took time from their schedules that had interests in this. So, my thought is we want to hear from everybody we can, but I do understand that it can be distracting for the speakers. It can be distracting for the board to have, the comments coming at the time we're trying to have these conversations. So maybe, I don't know what everybody else thinks, maybe we just open the chat box or the chat feature at the time that we're going to take public comment.
Yeah, I think that's an excellent idea.
I agree with that also. I mean, if we were in person, it would be really hard to conduct a meeting if we were being shouted out, shouted down the whole time. So I agree with that assessment.
I agree also.
I'm just a little gun shy on that. When we did the very first YouTube meeting a couple years ago now, we left the comments on during the meeting, and there were some extremely derogatory things said about board members in that forum. So, I don't want to get there again in this platform. Okay, so we'll do that. So public, we'll give you 2 minutes to make comments. Just as we've been doing with the previous meetings, just place your name in the chat box and I'll call on you one by one. Again, members of the public, if you wish to comment, type your name in the chat box. All right, it looks like we have Kevin here first. Kevin, go ahead.
Hey, I just want to first thank all the speakers for coming, volunteering your time. One thing that I've just asked is for the Office of Medical Cannabis, can we have a kind of like a ticker on the front page of the website showing how many patients are registered, kind of like a little counter or something like that?
Yeah, so I'll address that real quick, Kevin. We are going to have live data that's on the way. However, it's not quite ready yet, but it is planned for the future. Not only just patients, but also amount of products being sold. Okay, next up we have Brent.
Hey there. So I'll try to make this as quick as possible. I understand the talking points from everybody, both sides. What I don't really get is that regardless if they're medical, not medical, cartel or not cartel, people are going to grow regardless, no matter what we do or anyone else does. You're not going to stop that. I mean, just like that officer said, they're already growing. So I don't really see where that's a point or for this meeting. The other thing, I guess, is that I'm was diagnosed with Chiari malformation. I don't know what you guys know about that, but it's a lot of pain. I got my card. This is almost a year ago. Jefferson County is where I'm residing. There is no place open. So I've had my card almost a year with no chance of trying it, unless the closest place I can go is to DC and get it there. Now, do I risk going across Maryland and Virginia to get it, and possibly get arrested for that? Or would it, it'd be easier for this to grow at home so I could just do it myself and not have to worry about any of that? So I think that yeah, that's pretty much all I have to say about it.
Thank you. I got a message from staff that I missed Don Smith. Don, I don't see you in my chat box, but if you want to comment, go ahead.
Thank you very much. Can you hear me?
Yes, sir.
Have a few factoids that I would like to share. The first being, and please research it for yourself, but for the people from out of state talking about the black markets, West Virginia's #1 cash crop has been cannabis for over 4 decades. That's kind of a stunning fact, but it is, from what I understand, a fact. I am a hemp farmer. I've possibly grown more hemp per plant than anybody in this state. It's a difficult business. I think it's completely overregulated, and we're really trying to industrialize this, going away from the CBD business and into sustainable aviation fuels, rare earth, agri-mining, hemp graphenes, things of this nature. So I've grown a lot of plants. My wife has multiple sclerosis, and I find it really odd that I can grow millions and millions of plants, but yet I cannot grow my wife any plants here. I cannot grow any of my friends' plants. I think that's just completely wrong. Since the time of the cannabis prohibition, 24 million Americans have wound up on the wrong side of the law. And for an aerial perspective, that's enough to fill a Super Bowl stadium. I think it's 460 times. Now, that just kind of goes to show you the abject failure of the overall cannabis prohibition, this so-called war on drugs. The numbers that are being produced in Colorado and in
Don,
California are just
your time's
atrocious.
elapsed. I'm going to need you to finish up, please.
Will do. But anyway, we can do better than that in this state. Maps indicate that we are a primary, beautiful place to grow cannabis. We've missed the boat. But as far as I'm concerned, I can appreciate any unintended consequences that comes from these programs, and they should be mitigated and gamed out well in advance. In my very first comment in the very first Medical Cannabis Advisory Board meeting regarded quality. We have to make sure that we have quality built into these programs. To do that, you use statistical process control and continuous process improvement. Now, once we get a grip on that, we make money in our industry. And
Don, I apologize, but I'm going to have to cut you off.
Understood. Thank you so much. Have a good day.
Thank you. Aaron Carey.
Hello, can you hear me?
Yes.
Hi, I don't know if my camera's on or not.
It is.
Mine is really, really short. I have to say that I'm a nurse in West Virginia. I've commented before. I was a co-owner of a dispensary, and me and the co-owners have sold it, but I still am on the fringes and studying. And I have to say, I've taken quite a few notes from today, and I'm feeling really inspired for our program in West Virginia. I think it's fantastic to have all of this information and people from different states willing to come and participate, to educate us. I see a really good opportunity here, and I'm going to write up an email. I'll send it, and hopefully some of you read it. If you take anything away, I just wonder also if whenever you're listening to these points throughout these conversations, if you had similar thought process. So anyhow, that's all I have to say. Thank you everyone that participated, and thank you all for your work.
Next we have Becky. Becky, are you there?
Yes, sorry, I was unmuting. Thank you. I have a question. I've had an experience. I'm a patient as well, and just wanted to give a little feedback and thank you all for what you are doing. I'm experiencing at some of the dispensaries that the quality of the product is not quite should be allowed to be sold. For instance, we've got the one store that has been located in Williamstown, and the product is very, very less in quality, but yet we're paying top dollar for that. Is there anyone that is regulating that, or who takes the complaints or the concerns of what is being sold? And if it's not optimal, I'm driving over 2.5 hours to go there, getting the product, and it's not really the quality of the same product I would get if I would drive to Morgantown. And I know that growers, they can't always be consistent, but I am concerned, who do you address that with if you're buying things and it's not, what they're saying it is on the website, or you feel that it may not be what, versus if you're getting a 12% in Morgantown and I go to Williamstown and they've only got 6%, but that's all that the state has to offer because there's no one else open that has product at this time. So you buy that, you almost feel like you're flushing your money down the toilet because it's what they have. And when you say something to them, they're saying, well, sorry, hopefully things will get better as time goes on. So who do we address those concerns with? Is it just up to the store itself?
So the Office Medical Cannabis, the office that I run, would be the place to place complaints regarding dispensaries. However, I'll take just a minute to address what you said. Our concern is safety of products and security of products. It sounds like you're speaking more to your satisfaction with the products. We've had folks mention the products were too dry, things along those lines. That's not something we're going to regulate. Now, it is possible that there could be too much moisture in a product, or perhaps if you have evidence that the product doesn't align with its lab report, we could certainly investigate that. But
I think that was more of what I meant. So thank you for the terminology, as I felt that even though they were advertising 6%, it sure didn't feel the equivalent of what I was going to the other store and getting. So I just wondered how that's being regulated, as a consumer, how we can know.
You can certainly direct those comments to OMC, but however, just based on what I'm hearing from you right now, I don't think we would take any action based on your personal feelings regarding THC levels. We would have to see some evidence that you're presenting that the product is not matching the lab report.
Right. I was just wondering, as a consumer, though, is there a place that we can look at that besides just going to the store? It's not being advertised on the websites. So you drive all that distance and you don't know what you're going to get that day, if that makes sense. It'll just say the name of the product and it'll say the amount of the grams.
The dispensary has to provide you with the full lab report of the product if you ask. All you have to do is ask them.
But do they have to put it on their website so that you know ahead of time?
No, that would be a massive amount of data, and no, they don't, and I don't even know that it would be practical.
Thank you.
Let's see. Looks like we have Dr. Husted next.
Thanks, Jason. Can you hear me okay?
Yes, sir.
Perfect. Thanks for taking my call. I know there's been kind of a concern that any kind of dissenting opinion, has been kind of pushed back, that some people don't want to hear the downside of this. I understand that, it's been a challenge for people to possibly say something negative against this. My background is I'm in addiction psychiatry, which I understand has been kind of said that that's bad, that I'm somehow trying to treat folks that struggle with addiction. I have no ties to industry. I don't run a rehab. I don't own marijuana stock or pharmaceutical stock or anything like that. The concern I have is that there is a double standard that exists, that if somebody like myself who sees what can happen, not to everybody who uses marijuana, but at least 10% who struggle with this mightily, anytime we bring up our concerns, suddenly, we're not impartial. We're just working for the pharmaceutical industry. I feel like there's a double standard that exists when professionals like, for example, Ken and Joe, people that have been around this, how we immediately dismiss anything they say because it's not what we like to hear. When the reality is that some of the people that are proponents, you've heard it today, I own a dispensary, or I just sold my dispensary, or I grow hemp. So who's to profit from it? Of course, they're going to be in support of more and more marijuana. And again, I would just caution that we had people from Colorado and California who know this much more than we do. And they're certainly seeing that it's not all wine and roses. There is a dark side to this. It's not reefer madness, it's reefer reality. And I would just encourage everybody to take any dissenting opinions into consideration, not just immediately say, oh, they don't know what they're talking about. We brought up these same concerns about opioids 25 years ago and were largely ignored. And look where we're at now. So I would just say ignoring experts, whether they're in this state or out of state, is that's a risk. And I just want people to know exactly what they're getting into. So thank you.
Thank you, sir. It looks like Joe Hatton's requesting copies of the presentations. Joe, I'll do my best to facilitate that. Thank you. Any other members of the public that wish to comment, please put your name in the chat box. All right, folks, I think that's it with public comment.
Jason, could I ask you not to include my first slide, which does have personal information on it? I do not need the hate mail and hate phone calls that I will receive. So I'd appreciate if you just delete my first slide. You can put the rest of the slides out there for everybody.
Yes, sir. I'll follow up with email via email with you about that. However, this meeting is typically posted on YouTube, which will include that slide. I don't know if we can cut it out. I can certainly try, but I don't know if that's possible or not.
Thank you, sir.
Thank you.
Jason, if you need help doing that, I also do video editing. I could cut that slide out, at least just that little section with his personal information before you upload it to YouTube. It would take a few minutes.
I'll check with our communications folks and see if they can do it, and if not, I'll reach out to you.
Cool.
Thanks. Okay, moving on. So action items for the next meeting. I know we don't have many members left here, but we do have Rusty's home grow recommendation as an action item. Anyone else want to bring up any possible action items for the next meeting?
I think depending on our subcommittee meeting, we may want to bring up the impairment issue, but I think we want to wait till after we have our meeting to decide if that's what we want to do.
Okay. Any other items from any members? All right. Next up, we have the date of the next meeting. If we continue as is, it'll be Thursday, 6/16. Does that not work for anyone that's still on here? 12 to 1:30?
What was that again?
That'd be Thursday, 6/16, June 16th, 12 to 1:30.
Yeah, that's okay.
Thanks, Jason.
All right, we'll go with that. Topics for discussion. I need to just remove that. It's redundant, but that is it. Does any other board member have anything they wish to talk about before we conclude the meeting?
I would just like to say thank you to all the speakers who took time out today to participate in the discussion. We do truly appreciate all the input.
No, definitely agreed. Thank you for joining the meeting, everyone. If you all are open to it, I know we're way over time, but it looks like we do have one more question from the public.
Fine by me.
Okay. Mr. Perko, go ahead.
Hi, Jason. I was wondering if the recommendations that were previously formed would be reintroduced.
That's totally up to legislative leadership. Again, they have the information. We can certainly resend it when next session rolls around, but again, that's not something within DHHR's control. As mentioned earlier, if board members wish to advocate for their recommendations, they're more than okay to do that. But all we can do is provide the information from a DHHR perspective.
To piggyback on that, if any of the working groups are interested in identifying allies, within the legislative body, I think that, industry would be very interested in having those conversations as well. So if there's ever an opportunity to volunteer on those working groups or just as an outside party, but related to industry, I think those are meaningful conversations that we could assist with.
Mr. Perka, this is Jesse Forbes. From the Public and Policy Work Group, I'll tell you, our meetings are always open. We've had industry representatives there in the past at other meetings and other topics. We'd be happy to hear from anybody in industry that wants to work with us, to attend the meetings and provide comment to us. And if there's maybe some specific item where you think there's someone from industry that might want to speak or help us with what we're working on, we're happy to have that. So just the meetings that we have are noticed, and certainly anybody from industry can take part in those.
Thank you very much. I look forward to it.
Anything else from any members before we conclude? All right. Does anybody want to move to close the meeting?
Motion to close.
Second. Does anyone oppose? All right. Meeting concluded. Thanks, everybody.
Thank you.
Thanks.